morning to everyone, and thank you, Professor Donner, for this kind introduction. I have no conflict of interest to disclose, and so basically transfusion-dependent anemia is associated with a significant decrease of the quality of life and life expectancy in patients affected with low-risk myelodysplastic syndromes. Erythropoiesis-stimulating agents, ESA, are the reference treatment for transfusion-dependent anemia in this clinical setting, but however, the efficacy is quite limited. Luspatercept is an erythroid maturation agent that modulates the TGF-beta pathway, resulting in an improvement of erythropoiesis. And luspatercept was found to be associated with a clinical benefit in treating transfusion-dependent anemia in low-risk MDS after ESA failure in a specific subset of patients carrying SF3B1 mutation and ring sideroblasts. Here we present the interim analysis of the COMMANDS phase 3 randomized trial that compared the efficacy and safety of luspatercept versus Epoetin alfa in the treatment of transfusion-dependent anemia in ESA-naive low-risk patients with myelodysplastic syndromes. Overall, 356 patients were enrolled and randomized to receive luspatercept versus Epoetin alfa. The primary endpoint of the study was defined as the achievement of a transfusion independence for at least 12 weeks with a concurrent mean increase of hemoglobin of at least 1.5 gram per deciliter. So the primary endpoint was achieved in 59% of the patients treated with luspatercept versus 31% of patients receiving Epoetin alfa, with a difference that was highly statistically significant. The clinical benefit of luspatercept was observed in all MDS subgroups stratified according to hypoendogenous level, the severity of transfusion dependency, the mutational status of SF3B1 gene, and the presence of ring sideroblasts. Luspatercept provided a durable and longer duration of transfusion independence as compared with Epoetin alpha, and this effect was observed regardless the presence of ring sideroblast, the endogenous hypo level, and the severity of transfusion dependence. So in terms of mutational profile, mutation frequency at baseline was not significantly different between the two treatment arms. And as you can see here, a patient with specific MDS-associated gene mutations, especially including SF3B1, XXL1, and TET2, were associated with a better response with luspatercept that was irrespective of the mutational burden. With respect to the safety, luspatercept was associated with a very good safety profile that was consistent with previous clinical experience. The progression to acute myeloid leukemia was low and balanced between the two treatment arms. So to conclude, the COMMANDS study provided evidence for the superiority of luspatercept versus Epoetin alpha in the treatment of transfusion-dependent anemia in ESA-naive low-risk myelodysplastic syndrome patient. The primary endpoint was achieved in 59% of the patients treated with luspatercept versus 31% of patients receiving EPO. Luspatercept was associated with a longer duration of transfusion independence as compared with EPO, and the clinical benefit of luspatercept was observed across all patient subgroups and regardless the overall mutational burden at baseline. Finally, the toxicity profile of the drug was very good and consistent with previous clinical experience. Overall, these results can be considered a paradigm shift in the treatment of low-risk MDS-associated severe anemia. And thank you very much for your attention.